Hello, everyone, and welcome to the webinar. My name is Megan Nicholson, and I'm the Director of Marketing at Wellbe.me. We're happy you've decided to join us today for The Empowered Patient of the 21st Century, How Technology Enables Good Medical Practice. A few housekeeping details before we get started. This webinar is being recorded, and you should receive a link to the recording and slides tomorrow by email. Please feel free to share this webinar with colleagues who could not attend today. A question and answer session will immediately follow the presentation. If you have a question for our speaker, please type it into the Q&A box in your GoToWebinar panel on the right side of your screen. Today's webinar is sponsored by Wellbe's Guided Care Path. A guided care path helps create a single streamlined patient experience through the entire journey of an acute care episode by creating a continuum of connection between patients, their families, and their providers. Smart checklists are delivered just in time as patients progress through their care plan. The information is always there for reference when needed in case preparation or follow-up instructions are forgotten. This helps reduce patient anxiety and improves outcomes. To request a free demonstration, respond to the poll at the end of the webinar. Now I'd like to introduce our speaker for today. Nancy B. Finn is a healthcare journalist, thought leader, and patient advocate, focusing on patient empowerment and engagement with the deployment of digital communication technology. She is the author of ePatients Live Longer, the complete guide to managing healthcare using technology. Nancy, I'm going to hand the controls to you, and you can take it away.
Sounds good. Okay, so as Megan indicated, I'm going to talk about patient empowerment and the relationship between patient empowerment and digital communication technology. And Megan has already introduced me, so I'll move right into the key points of this presentation. My objective today is to paint a portrait of today's e-patient. By no means do I mean to imply that the majority of patients are empowered and engaged. They are not, at least not yet. However, they are growing in numbers, and this trend is not going away. Therefore, I will cover the important questions that this new direction raises, including what drives e-patients, what are the digital tools they use to seek out health information and to engage with their providers and caretakers, what are the priorities they assign to communicating with their providers, why communication and collaboration are so important. I will cover the challenges patients and providers face in the digital era as we move toward our healthcare future, where patient-centered care that is dependent upon these digital communication tools and the patient-provider partnership will take shape. So right now, I'd like to initiate a poll, and the question for the poll is, are you an e-patient?
Right.
You'll see on your screen that Megan has given you a poll open and a way to indicate your response. And as you're thinking about whether or not you're an e-patient, I wonder if you might want to note those actions that you follow and those actions that you may want to follow that I discussed through this presentation.
Okay, we're going to close the poll in a few seconds, so get your votes in. We'll share the results. So it looks like we have 62% say yes, they consider themselves an e-patient, and 38% say no.
Great. So at the end of the presentation, perhaps in the question period, we can talk about some of the questions you have regarding e-patients and some of the issues that I've raised in that sense. So what is the profile of the 21st century patient? Today's patient is bombarded with sound bites from many different sources. To get through this Tower of Babel, patients typically go to the web, talk with their providers and friends, read publications to stay abreast of what is going on in healthcare. To state it simply, today's 21st century patient is smart. These patients read articles and watch television programs on health. They are concerned about health issues, their own and those of their family and friends. They discuss these issues. Today's patients are also confused about their health care choices. They're overwhelmed with the decisions that they have to make regarding their health. Such decisions as, which provider do I choose? What treatment am I going to opt for? And particularly, how do I pay for my health care? Patients are deeply concerned about the cost of care. Today's patients also have high expectations about health care and expect to get their immunizations, screenings, and needed procedures without being challenged or put off. What are an e-patient's priorities? E-patients are seeking to ensure that complete information about them is available to them and to all their providers at the point of care. This is a point that you're going to hear me reiterate several times through this presentation because it is such an important facet of healthcare today. E-patients value compassionate, safe care because they read and hear too many horror stories about medical errors that can happen to them when receiving treatment, or have bad experiences with providers who merely give lip service to their concerns. E-patients are seeking two-way communication with providers who give them more than a 10-minute allotment of time to talk about their health issues, who listen to what they are saying, and who respond with interest and compassion. E-patients are seeking help in finding good resources and the right tools to learn more about their health issues. They want clear instructions, specific follow-up steps when discharged from the hospital or when they leave the doctor's office. They are confused and concerned about the cost of their care. How could we not be concerned about the cost of care or the structure of our health care reimbursement system after what has recently taken place in Congress and in Washington and the rhetoric we have been listening to? Compassionate, safe care. Because e-patients are more informed and invested in their care, they realize there are quality and safety issues that are often not met. According to the latest statistics, 210,000 medical errors occur annually. 1/6 of all deaths are caused by medical error. This is an astounding number. Today's patients want relationships with healthcare professionals who are open with them, tell it like it is, and listen to their concerns and complaints. Encourage them to be involved in their health decisions so that they are more knowledgeable and so that they can be aware of situations where medical errors might occur and hopefully avoid them. E-patients want to be assured that their own personal situation for managing and for paying for care are taken into consideration and understood by their care team. In other words, that their care is patient-centered and not provider-centered. Give me my data. There's a small percentage of vocal e-patients today who are advocating for access to all of their data that is in their health record. These smart patients want to know, actually feel they have a right to know, what is going on with their health care. There is a software platform that has been developed called Open Notes. This is an initiative that invites patients to review notes written by their doctors, nurses, or other clinicians during an office visit. The Danville, Pennsylvania-based Geisinger Health System is known for being on the cutting edge of innovation in healthcare. Geisinger launched Open Notes system-wide last May. Now, more than 100,000 patients view the notes of more than 500 participating Geisinger physicians in primary care, pediatrics, and other specialties. Obviously, one-on-one, the patient views their own physician's notes. These doctors and patients are finding Open Notes to be transformational in activating them to become more engaged to help them work with their providers for shared decision-making, to correct misunderstandings, and improve the content of their medical records. The question is whether this access is going to become the standard. Obviously, the vocal majority I spoke of earlier would like it to be the standard soon. Most likely, it will become a standard eventually, not immediately, but certainly over time. Today, the majority of patients still want their doctors to make decisions for them, or at least help them make decisions without requiring them to be on top of every aspect of their care. There are also many patients who are simply ambivalent, so it's not everybody that is lobbying notes. A big part of the issue around providing full data to patients is the question of what patients do with their data once they have it, and what clinicians want them to be doing with it. These are open-ended, unsettled, evolving issues that go right to the heart of patient empowerment via technology. Challenges. Patients are challenged about how to navigate the healthcare system. They are particularly challenged about how to determine their cost of care. They are challenged when they must cope with illness during difficult times, especially when there are many options for treating a medical problem, and the patient does not know where or to whom to turn to help make these critical choices. For example, should I opt for aggressive treatment? Should I wait and see what's going to happen over time? Should I have surgery, or should I take the route of medication? These decisions are never easy, and the doctor can only advise to a point. Patients are also challenged from information overload, mostly from public sources, while at the same time they find their providers give them too little information, which forces them to seek help from these public sources and the Internet. This is a dilemma not easily solved. Challenges that providers face. Providers are challenged just coping with the large numbers of patients they must see and how to individualize care for each one in a system that restricts their time with the patient. They are challenged getting their patients to become engaged and comply with instructions and prescribed medications. They are challenged by the concept of collaborative care, where patients are full partners in their care. This is a cultural change for most providers. They are also challenged with the task of providing appropriate tools to help empower their patients to do more for themselves. Savvy providers are beginning to see that patients want information and a part in health decisions, that their patients access and use health information with the digital tools, that they expect their providers to communicate with them and accept them as partners making choices together. Savvy providers are beginning to understand that their patients do not want precious minutes of an office visit to be taken up with the doctor searching through the patient's record looking for information. Many now ask their patients to update their information online in advance of an office visit so that the doctor is briefed on the patient's latest medications and symptoms before the patient walks through the door. Savvy providers also offer their patients tools for ongoing communication between office visits for non-emergency issues that arise. For example, email contact or a patient portal where they can engage in messaging. More about that in a minute. Savvy providers themselves use the Internet for evidence-based medical practice and to keep up with the fast-moving developments in every medical specialty. Savvy patients are busy online, talking to others, gathering information, and becoming very specific about what they want from their healthcare providers. Savvy patients create personal health records that include all of the medications from the many doctors, specialists, therapists they may see. These personal health records include an extensive medical history, medications, and allergy lists. Savvy patients come to an office visit armed with this information. They do not depend upon the doctor having this data in a digital record. Savvy patients also come to their office visit with a list of questions and issues prioritized according to what is most important to them, because they do realize that the visit is limited to a certain time frame. They speak up when they are not comfortable with what their physician or provider may or may not be doing. I'm going to tell you the story of a savvy patient. She lives in a rural community and has been diagnosed with breast cancer, which was spotted on a mammogram. Her primary care physician, PCP, refers her to a cancer center 2 hours away for further screening. The doctors there decide she needs surgery, and they send her to a large hospital 100 miles away. Prior to entering the hospital, she is instructed to collect all of her medical records, so that with help from a nurse in her PCP's office, she creates a personal health record that includes all of her medical history, scanned images, lab tests, lists of medication, and so forth. Not an easy task, to be shared with all of the doctors who are treating her. By having this information available, this savvy patient is able to keep everyone fully informed. She avoids the possibility of a medical error happening because data about her health history is missing. She is a savvy patient who works with the system to ensure her well-being. The work involved in generating a personal health record is a cooperative effort between a provider and a patient based on collaboration and good communication. So finally, we get to the list of tools for e-patients and savvy providers. The first tool are digital health records, both electronic health records and personal health records that can be accessed by all providers, patients, nurses, and therapists, and even a rehab facility. Electronic health records include medications and allergies, a complete medical history, and help to ensure full up-to-date information on the patient is at the point of care. They enable doctors to send reminders to patients and to help them quickly access test results and engage in best practices for the individuals. Then there's email. Email facilitates messaging. It's immediate, available 24/7, and enables communication from anywhere at any time. Email eliminates the time constraints of patient-physician communication. Pictures can be sent, scans and records can be forwarded. Email results in a more satisfying, ongoing relationship between providers and patients. It provides a feedback mechanism that helps patients stay on track with medication compliance and other issues that come up between visits. Patient portals are online websites that enable secure communication. Portals foster patient involvement, enabling them to access labs, get referrals, renew prescriptions, and easily connect to educational materials. Portals help the patient manage some of the details of their care and cut down on unnecessary office visits by enabling online e-visits and interactions. They help doctors by providing a secure messaging forum where the doctor can post reminders to patients. For example, get your flu shot, or they can post patients' results and automatically schedule a call or an online visit, saving the doctor time and creating better communication and relationships with their patients. Then there is Health Information Exchange. Health Information Exchange provides the capability to electronically move health information between various systems while maintaining the authenticity and accuracy of the information being exchanged. This sharing of critical and administrative health data electronically, provider to provider, provider to patient, patient to caregiver, enables the care team to make safer, more informed decisions. For the patient, health information exchanges collect the disparate silos of their information and keep that in one place for easy access and transport, eliminating the need for redundant tests, and enabling the patient's information to be available no matter where he or she is transported for care. The formation and deployment of health information exchanges is a requirement to achieving meaningful use of health records mandated by the American Recovery and Reinvestment Act of 2009. However, there have been many attempts to form both regional and a national health information exchange with initial funding from federal grants to states. Unfortunately, few of these HIEs have been successful because they have not been able to work out a sustainable funding mechanism. Implementation of a health information exchange is a greater task than any single patient or provider group can accomplish. So although health information exchange is an important digital technology that will help us achieve the kind of changes we need in healthcare today, it is unfortunately a long way off for most of us. On the other hand, smartphones are a reality for all of us. In 2016, it is projected that 1.4 billion people will own smartphones. 500 million will use a variety of health apps. The latest statistics are that there are more than 12,000 health apps currently available that put patients in control of their health. Everything from an ever-present fitness coach to an FDA-approved heart monitor, body weight scales, vital sign meters, health monitoring tools to track and note triggers for asthma attacks, blood pressure, blood sugar, heart rate, electronic stethoscopes, emergency first aid, and CPR. And one app that I want to describe just briefly is an app called ICE in case of emergency. This is an app that virtually lets the patient put into their phone the elements of what would be in a personal health record, as well as the name of an emergency contact that the providers in an emergency room, for example, should be in contact with if the patient comes in unconscious and unable to convey that information. The ICE in case of emergency health app overrides a phone that might be locked and can be accessed by an emergency room doctor or professional at any time needed. Smartphones will continue to change the way healthcare potentially is delivered, with more apps as yet unimagined. Last but not least among the digital tools are online resources, the web for quick access to health information and evidence-based medicine, and social networks for engaging and comparing notes with other people with similar health issues. Now, I was hoping that we could, at this point, do another poll. And that poll would be to ask you a bunch of questions or a question with some choices on which of these digital communication tools you are using today.
So we have that poll up on the screen. You can check all that apply. Which of the following tools do you currently use? And we'll leave it open for a few seconds for everybody to get their answers in. All right, we've got 60% in. We're going to leave it open a few more seconds. Get your votes in. Put down your lunch. All right, we'll share the results now. Looks like we have 27% for electronic health records, 64% for email with healthcare providers, 36% for patient portals, 36% for smartphone apps, and 55% for web resources and social networking.
Great. So I want to go on to talk about how patients are using these digital tools. Patients go online for health information to diagnose health issues themselves or to arm themselves with information to discuss with providers. They use smartphone apps to monitor conditions and follow a diet, measure their workouts, check their vitals, access directions for health and emergency situations. They engage in conversations with people on social networks about their health issues and look to these sites for clinical trials and experience of others that may parallel their own. Obviously, many of you are emailing your providers for faster response to questions and to get rid of telephone tab, which is so frustrating. When available, patients are using portals for secure online conversations and to access and view their data, such as labs and procedure reports. A recent survey of 1,000 adults indicated that 85% use the Internet, 91% of adults own a cell phone, 56% of adults own a smartphone. 64% of people are taking health into their own hands and look up some kind of health information online. Many are just seeking general health information, but 40% cited self-diagnosis and 38% said they were evaluating whether to see a doctor. 31% of those surveyed said they would be willing to pay for online consultations with their doctor, and 20% said they would be willing to communicate with their doctor online. Where do patients get information? According to a study from the Pew Internet and American Life Project, more patients get information from friends or their doctors than from the Internet in spite of all this online activity. The study, published in May 2013, found that although 72% of Internet users say they looked online for health information within the past year, it appears they do not use this information specifically for personal health solutions. For this purpose, they still depend on their doctors, their family, and friends, and use the information they find on their web for additional understanding of the issues. So I want to turn now to a little bit about the web. The sheer volume of information on the Internet changes the dynamics of health information dissemination. We have been talking about smart patients and how they go to the web for information about savvy providers who use the Internet and encourage their patients to do the same. In 2001, there were 70,000 recorded health websites. Today, there are several million websites that deal with health, too many to keep track of among the several billion websites that exist. Access to these sites is not equitable among patients, and use is hindered by navigational challenges due to numerous features, including bad design, disorganization, technical jargon, and lack of permanence. Increasingly, critics question the quality of online health information. Research indicates that much is inaccurate. Meager information adds to a patient's vulnerability when using the web and reinforces the need for quality standards and widespread criteria for evaluating health information. For best websites, since there are many bad ones out there, for best websites, I would recommend the institutional sites such as Mayo Clinic and Cleveland Clinic, or the site that is out there that a patient's own hospital might refer them to, that has information and access to information about drug databases and so forth. The government sites are also excellent sites, including the CDC and HHS.gov, where there's a wealth of information. Additionally, the specific disease sites, including those of the American Cancer Society, American Diabetes Society, American Heart Organization, and many other disease societies, offer solid advice, tools, and resources. And I would mention 3 gateway sites, which are kind of catch-all sites for everything there is about health, which are vetted, meaning they are the information there is reviewed by professional healthcare individuals, and the information is reliable. And these include MedlinePlus.com, HealthFinder.gov, and WebMD.com. Questions to ask regarding the reliability and credibility of information on a health website include: who developed the site? How current is the information? Has the content been reviewed by medical professionals? Can it be verified by other sources? Is this a reputable site? Is there contact information to send questions or comments? Does the site include advertising or suspicious remedies that make questionable promises? Is the site filled with medical jargon? And does the site offer to sell you drugs without a prescription? Obviously, sites that include advertising may be biased. If they promote suspicious remedies, it is a warning to keep away. Sites that are filled with medical jargon or offer to sell you drugs without a prescription are also sites to be avoided. And now we come to social networks. According to the latest research, approximately 70% of adults who are online use social networking sites. Although younger adults continue to be the most likely social media users, there has been a substantial growth among older Internet users in recent years. Those ages 65 and older have roughly tripled their presence on social networking sites in the last 4 years, from 13% in the spring of 2009 to around 43% today. E-patients use social networks that are focused on health issues to find answers to their health problems and conditions. They may also obviously use sites like Facebook and Twitter and LinkedIn, but in terms of health, they go to the sites that are focused on health issues. Answers that are not readily available from traditional health sources, including providers, may be found on a social network. So e-patients seek the companionship of individuals who are experiencing the same issues and problems they are facing to help them get specific advice, emotional support, and current information. These social network interactions become convenient and cost-effective to deal with the often scary unknowns of illness. Overall, the advantages of social networks are that they drive patient collaboration and information sharing and expand the patient's knowledge and enable them to leverage the collective experience of the group. The disadvantages for patients using social networks is that a lot of misinformation can be communicated. Finding the right group within a social network can be daunting. The number of tools and sheer amount of options can be very overwhelming. The best social networks that provide vetted health information in active groups include Patients Like Me, Inspire.com, and Daily Strength, that each include groups for nearly every conceivable health condition, as well as tools, resources, and vast information repositories. There's also ACOR, which is strictly for cancer patients. There's ICU, where you can view, post, and share health videos. And My Family Health, that lets you create a family health record, which can be shared. Obviously, there are many, many more social networks out there specifically geared for health issues. But these are the ones that are reliable and credible and have proven to be accurate in terms of the health information they impart. Patient-centered care, this concept dates back to 2001, when the Institute of Medicine declared, after extensive study, that the healthcare system of the United States needed to transition from traditional provider-dominated care, where the clinician made all the decisions and wrote orders to the patient who was supposed to follow these directions and report back, to patient-centered care, where individual preferences and values, and most important, opinions of the patient, were to guide all clinical encounters. Why has it taken us so long to get even close to experiencing patient-centered care? Perhaps because it is hard to change the culture of an industry that has been around thousands of years since the advent of the witch doctor. Hallmarks of patient-centered care include the team concept, where the patient is part of the team that reviews the issues and makes healthcare decisions. Other members of the team include the primary care doctor, a nurse practitioner or physician assistant, specialists, family members, therapists, all working together, a novel concept. With patient-centered care, care is coordinated, which requires a major commitment from patients and providers, but is intended to ensure that the patient is receiving the most appropriate care for that individual. The care team involves a long-term relationship via the medical home, continuous health relationship with the same care team incorporating full access to and use of all digital communication tools. Coincidentally, the idea of patient-centered care in the medical home helps to address the severe PCP, that is primary care physician shortage, we are facing in this country, as the basic health services provided to the patient can be handled by nurse practitioners or physician assistants who are then supervised and assisted by the physician on the team when needed. Inpatient care. I became an e-patient when my own medical issues became complicated and made me take a good look at my interactions with my healthcare team. It is why I wrote the book, E-Patients Live Longer. Recently, I had surgery for a hip replacement, so I had to determine how to choose the doctor and hospital I would use. The most important factor was that my full information be available at the point of care. So I chose a hospital where all of the doctors on the team would have access to my electronic health record. That way, the care coordination that I needed would happen transparently. There are several online sites where you can evaluate hospitals and procedures to help you determine where to go. They include Healthgrades, Quality Check, and Hospital Compare. However, there is one other important issue for an inpatient experience, and that is the thoroughness with which the team approaches your follow-up care and communicates those steps directly to you or to your advocate. Just briefly, I want to stress the importance of patient advocates. E-patients are e-patients because they take responsibility for their care, and part of that is to make sure that if they cannot oversee their own care, they have an advocate. Ideally, a family member or friend. The availability of digital communication technology, where records are kept and email makes communication easy and fast, helps patients inform their advocates about all of their health needs. If a family member or friend is not available, the empowered patient requests that the hospital social worker arrange for an advocate, and in advance, the e-patient prepares a signed legal document expressing their wishes regarding important questions related to long-term care and an authority for an individual to act as a power of attorney to execute these wishes in today's complex medical environment. Having a patient advocate is an essential part of good practice. Chronic care management. More than 120 million people suffer from chronic conditions. The responsibility for managing and monitoring these conditions are a shared responsibility between empowered patients and doctors whose goal is to keep the patient from ending up in the ER or worse. Digital communication technology, including smartphone apps and monitoring devices that connect to telephone lines and check out everything from daily weight and heart rate to fluid retention and breathing efficacy, are the tools that send a stream of updated information from a patient's home or office to a physician's office, where the patient-relayed data is interpreted and evaluated to determine if there is a need for change in diet, medication, activity level, or whatever to keep these conditions under control. Many patients post their data on portals each day, and others email the data to their clinicians. Whatever the media used, chronic care management is an essential activity that forces patients to be empowered and engaged 24/7. It means that patients have to be participants, and their doctors have to arrange for and encourage them to work with their office to regularly communicate what is going on. This fosters participatory medicine and sets the stage for advancing patient-centered care going forward. Connected health or telemedicine is an outgrowth of digital technology. The convergence of the internet, high bandwidth telecommunications, video technology, smartphones, sophisticated robotics, digital sensors, scanners provide the enabling technologies that give patients in remote, medically underserved areas or those who are homebound immediate quality care. From physical and speech therapy to mental health counseling, or in an emergency where there are no trauma facilities available, Connected Health provides the interface that hooks up patients with appropriate health care. I'm going to tell you another anecdotal story. A baby is born in a small rural hospital with a suspected heart murmur. There is no pediatric cardiologist on staff. The baby's films are transferred immediately after birth to specialists in the nearest large facility over 200 miles away, where they are read instantly and a diagnosis is sent back to the local hospital. Using an electronic stethoscope, the baby's heartbeat is transmitted to a pediatric cardiologist, and with a video hookup, he is able to help the local doctors do an echocardiogram that provides the data that enables the local and distant team of doctors to determine the best care to address this problem. Connected Health benefits beside the obvious ones pointed out in this story include reductions in the cost of providing quality care to chronically ill patients, ongoing preventive health for all citizens, especially those in medically underserved areas, and reductions in medical errors. It is one way of addressing the increasing shortage of primary care physicians, which is a major problem for everyone. And now what the future holds. There's a sea change coming. Patients and healthcare providers need to be prepared. As we move forward, whole genome sequencing will become affordable to everyone, with the result that voluminous amounts of personalized patient data will enable and require that every healthcare consumer or patient be engaged in making vital decisions regarding the way their healthcare treatment and delivery is executed. There are many other exciting developments evolving in the area of robotics in medicine, RFID technology, and more, portending some very exciting times ahead as yet unthought of digital communication technologies and applications are unveiled. That's the conclusion of my presentation, and I am certainly happy to entertain any questions you may have.
Thank you, Nancy, for that informative presentation. We will now open it up for questions. If you have a question for Nancy, please post it into the questions box in your GoToWebinar panel on the right side of your screen. While attendees are submitting questions, I'd like to remind everyone that today's webinar is sponsored by Wellbe.me. A guided care path helps create a single streamlined patient experience through the entire journey of an acute care episode by creating a continuum of connection between patients, their families, and their providers. Smart checklists are delivered just in time as patients progress through their care plans. The information is always there for reference when needed in case preparation or follow-up instructions are forgotten. This helps reduce patient anxiety and improves outcomes. To request a free demonstration, respond to the poll, which is going to appear on your screen. All right, now we have time for questions. Nancy, what should I personally expect from my doctor in terms of the use of digital communication tools, and how can I be assured that my doctor will agree to use email or online visits?
Well, today you definitely should personally expect the doctor will have an electronic health record. That's been mandated by the legislation that was passed in 2009 in the American Recovery and Reform Act, and is part of the meaningful use guidelines that doctors have to follow if they're going to receive their compensation or not be deducted in compensation from Medicare. So definitely you should expect your doctor to have an electronic health record. Many doctors have been reluctant over time. More and more are becoming used to using email with patients. It's not something you can force, but it's definitely something you should ask your doctor and indicate that you would like to communicate via email, and promise the doctor that you won't bombard them with email, because that's one of the doctor's fears, but definitely insist that you would like email communication, especially the access to be able to talk about an issue that is not an emergency in between visits, so that you don't have to wait the 6 months or a year before you see the doctor again to address something that is important to you, nor do you have to suffer through the agonies of telephone tag. As far as patient portals, it's only generally the larger patient groups or hospital-owned practices that offer patient portals at this point. They are becoming more common, and they certainly, as I hope pointed out, have many, many benefits for both patients and doctors. So you should certainly investigate whether your group practice or hospital has a portal that you can sign up for. It's amazing that there are portals out there in the major hospitals that only a small percentage of patients have signed up for because they just don't bother. But it's such an easy way to access data, get your referrals, do your prescriptions, that it's something that you should look into. In terms of smartphone apps, you know, that whole technology is just at the tip of the iceberg, just evolving, and some docs are very interested in allowing you to use these apps, and others are very reluctant because they don't themselves have familiarity with them. Similarly, with chronic care management, if you have chronic conditions and they're pretty severe, today most physicians are beginning to offer various monitoring tools or a way to monitor those conditions, either directly with the doctor or with a nurse practitioner, or in the case of diabetes, a diabetes educator. But there are many avenues for monitoring your chronic care conditions that are available and definitely should be investigated. And one of the best ways to do that is to work through the doctor's office, or if you've had a hospitalization and then been released and returned home, work through a social worker that is in the hospital to facilitate some sort of a chronic care management communication for yourself. I hope that answers the question.
Okay. We're going to close the poll in a few seconds, so get your answers in. Our next question asks, what is the doctor's biggest resistance to online video conferencing with their patients in their home if they're able to?
What is their biggest resistance to it?
Yeah.
I don't know that too many doctors are doing online video conferencing in their home, and I think the biggest barrier to that is the equipment. I don't think most doctors' offices have online video, you know, the technology available, or the understanding either to use that technology to be able to do online video conferencing. That's a lot different than doing an e-visit on a patient portal where you're messaging back and forth, but you're not seeing each other. It's not video. It's pretty much messaging and only messaging. So I'm not terribly familiar with online video conferencing as being a major technology. It's used extensively in telemedicine, but that's a whole different type of application where there are big telemedicine networks set up to address medical issues in medically underserved areas, and as I described in the case of the baby, to address issues that come up between remote local hospitals and large academic medical centers that would have more capability of diagnosing more rare diseases and issues and problems.
And we just have a comment from an attendee here that says a large portion of the resistance for video or email messaging is a lack of compensation for their time spent.
That is true, and actually there is now a code for compensating physicians for their time spent emailing patients, although I would point out to my doctor and to any doctor that balked about the idea of email that they're not compensated for their telephone time, and telephone tag certainly takes longer than a quick email message. So it is an argument that you hear all the time, but it's also an argument that doesn't have as much clout to me as it should, because The alternative when a patient has a question is to be calling in and expecting the doctor to call back. And my experience has been that that can take 5 or 6 phone calls before you connect. So that's absolutely true, and there is a code now that doctors can bill for email time. So those issues, again, should straighten out in short order.
You talked a little bit about personal health records. How does a patient create a personal health record and keep it up to date and store it?
Well, keeping it up to date is the person's own responsibility, and that's something that is one of the issues with personal health records is that people create them online on websites. There are many ways to create a personal health record, and the simple way of literally writing everything down on a piece of paper can be a personal health record. It's a lot better if you have it entered into a database of some sort or an online website. Personal health record forms are often available from health insurance companies, and they will populate your personal health record with their payment data, and then you can add your own data in terms of doctors you've seen, medications you're taking, etc. There are personal health record websites. Microsoft Health Vault, for example, enables people, individuals as well as people in groups and companies to create a personal health record, which will be there, and it's up to you to go in there every few weeks, months, or whatever and update the information. There's no easy answer in terms of updating a personal health record. It's something that people tend not to do and should do. But there are many websites, many organizations, many companies that have areas where people can create a personal health record for themselves, and it's something that if you really want to do, you should talk to your nurse practitioner in your PCP's office or physician assistant or the PCP directly and have them work with you to make sure that the various scans and other information that might not be available to you easily are available to go into your personal health record, particularly if you have an issue that you're dealing with and feel it's important to have that information at the point of care.
Okay, great. That's all the questions we have for today. If you have questions that you didn't have a chance to ask, you can email us at info@wellbe.me, and we can get back to you that way or forward you along to Nancy. Already watch your email tomorrow for a link to the recorded presentation and a PDF of the slides. Be sure to check out ePatientExperience.com to sign up for our free newsletter and our next webinar event focused on pain management. Thanks, everyone, and have a great day.